Ladies and gentlemen, dear colleagues, welcome to this press conference to go over the Quebec situation as far as COVID-19 is concerned. The Premier of Quebec, Mr. François Legault, is as usual together with the Minister of Health and Social Services, Ms. Danielle McCann, as well as the National Director of Public Health of Quebec, Dr. Horatio Arruda. Mr. Premier. Thank you very much. Hello, everyone. Before giving you the numbers of the day, I want to bring a clarification. You're going to see that the number of deaths is high. However, these are not deaths, for the most part, that come from the past 24 hours. There was a change in the method, in the way that public health takes all the data. There was also an epidemiological analysis that was made on patients that had died throughout the past week. And just to tell you as well, and it is important because a lot of people compare our numbers to that of others in the world, but here in Quebec, the choice that we made was to declare all patients, even those who were not tested, but who have all the signs that they were, in fact, affected and died of COVID-19. So we wish to have the true number of deaths of COVID-19, tested or not, and I think that it is important to be transparent, but also to have an exact idea. That doesn't mean that that is how it is done elsewhere in the world. So today, we unfortunately have 143 deaths for a total now of 630. So, of course, I wish to offer my condolences to the families of those people who have died. We now have 15,857 confirmed cases, an increase of 917. 1,018 people are hospitalized. That is an increase of 34. And we have now 209 people in ICU, a decrease of 9. So as you can see, if we look just at the situation in hospitals, the situation is really under control and really stabilizing. However, it remains difficult, as we've been saying for a few days, in CHSLDs, so the elderly who are vulnerable. Yesterday, I made a special call out to all doctors, specialists, to come and help us out in CHSLDs, not necessarily as doctors, but as people who can, with their knowledge, help out our nurses and orderlies. And I'm very happy to see that since last evening, we now have 2,000 doctors who accepted responding to my invitation. So I am very happy, I'm very touched, and I thank those doctors for coming and helping us out in CHSLDs. That is going to help us a lot. Of course, it's going to be quite a challenge to get all these people to work together, people who are not used to working together. It's not going to be easy. Communication is going to be important to define everyone's tasks, and it's not going to be perfect. We already know it. To get there all of a sudden and add 2,000 people in CHSLDs. But we will adjust ourselves as we go along. And what is important is to tell ourselves, well, let's all, admit that it's not going to necessarily be easy, especially in conditions that are exceptional. But I am convinced that with the good faith and goodwill of all Quebecers, if everybody just accepts mixing a bit of water with their wine, we can all do what is necessary, which is to take care of this national emergency to help the elderly, the most vulnerable people in Quebec. So I'm asking everybody to make that effort. I'm letting you ahead. Letting you know ahead of time. I'm sure that we're going to be hearing stories where, the tasks perhaps weren't well defined, and we'll adjust ourselves. But I think that we owe it to our elderly to make that collective effort, which is exceptional in nature. A word on our discussions with the federal government. First, what we ask the federal government is to have employees from the armed forces who are qualified in healthcare. Now it's not clear how many there are. There might be between 60 and 100. So it's not the 1,000 that people were talking about yesterday. That number is a federal site that is a little bit like our site in Quebec, the one called Je Contribue, I Contribute, where people who want to come and help put in their CV. But the vast majority of the 1,000 people who were on the federal site were already on our own site. So I just want to put that in perspective. We're not going to have 1,000 extra people who are going to be sent by the federal government in our CHSLDs. We might get 60, perhaps even 100. But we asked the federal government to send us all of the people that they could send to us that could help us out in CHSLDs. I also wish to take advantage of this topic to clear things up. I can see, as you can on Twitter and elsewhere, there are people saying, I put in my CV and I didn't hear back from anybody. First, we have to tell you, already we've asked thousands of people to come and help us. When those people had the qualifications that we needed in the region where we needed them. Of course, a nurse in Montreal who's qualified, we're not going to purposely refuse her. It's possible that there were a few cases that perhaps might have, not been looked at between the ministry who got the CVs and who sent them to establishments. But I can tell you that we're not purposely refusing people who are qualified because we need them more than ever. I also wish to say to the people who are finishing their studies in nursing care and in health in general, you should today receive a call. And the younger ones, you'll be able to come and help us out in CHSLDs in the course of the next few days. Another clarification. We had said that all the residences had been visited. It isn't the case. It was brought to my attention that all public CHSLDs were visited. The other ones are being visited as we speak, and it should soon be finished. But there are some that still have not been visited in residences other than the CHSLDs that are public. Now, my daily thanks. I wish to thank all those people who work in the shadows. I'm thinking about the emergency telecommunicators, for example, those who receive the emergency calls 24 hours a day. I'm thinking about the first respondents, the paramedics, the firefighters, the police officers who are there 24 hours a day, 7 days a week. I wish to really give them big thanks. We are lucky to have you in this present situation, which is exceptional in nature. And I would like to end by saying that even though the situation is critical in certain CHSLDs, we can see that in hospitals, the situation is pretty much under control and allows us, now that we have flattened that curve, to go prepare a plan to reopen and to deconfine. So we are starting with businesses. We wish to do it very gradually. We wish to do it intelligently with all of the rules that Dr. Arruda is going to be giving us. So we are working on that plan. We'll be able to talk to you about it in the upcoming days. But we really are starting by businesses. So for the time being, there is no question in the short term of reopening schools. So I wish to tell you, we're getting through it. We've got the nice days coming up in front of us. We have to have courage and we have to persist.
Today's numbers show us that the situation is under control in our hospitals. So we're concentrating our efforts in nursing homes where the situation is critical. The lack of staff remains our biggest concern. I want to thank especially the 2,000 physicians who answer my call for help since yesterday. We're doing everything we can to get through the emergency. It won't always be perfect, but it's time to unite all together and win this collective battle. So courage, everyone. Good days will return. Thank you all.
Merci, Monsieur le Premier ministre. Alors,
thank you, Mr. Premier. So we now start the question period.
Monsieur Arruda, je tiens à vous offrir,
Mr. Arruda, all my sympathies and sincere condolences for the loss of one of your colleagues from the Montérégie, 44 years of age, who was a specialist in community health and who died of COVID-19. Could you explain to us under what circumstances I was told that there was a specific problem in Montérégie? What can you tell us about this? Well, listen, I wish to tell you that when I talk of numbers here, I also know that behind each of those numbers, in every case, it's a drama for all the families and all their loved ones. That I want to say first and foremost. And for reasons of confidentiality and to respect the families, I do not comment individual cases. I find it important not to do it. But since it is in the media right now, I just want to say one information that perhaps could help people better understand certain things and eliminate certain worries, that this health worker did not acquire the illness in a healthcare setting. That's the only information that I can give you. So what that tells us is that it reminds us of the importance of applying the measures, I would say, in a healthcare setting where there's people at high risk, particularly in CHSLDs, but also that the virus can also hit elsewhere. It can strike in the community when you come back from traveling or elsewhere. So it reminds all of us that we are all susceptible, and it is important, in my opinion, to respect the guidelines. I thank you for your gesture, and I share it with the entire community of my colleagues here in Quebec. Is there any particular investigation that will be made, or is this being treated, because you're saying that he wasn't working in a healthcare setting, does that involve that it's being treated as a different death? All deaths are treated the same way, that they, generally speaking, that they come from one element or another. They're all treated in the same way. If the cause of death, or if the death is in a CHSLD or in a hospital with a doctor that has to diagnose, or if there are situations where it requires an investigation from the coroner, it's done, but it's not because it's a particular case. It's done as usual. We don't have the results yet, of course.
Bonjour à vous. Monsieur Legault.
Mr. Legault, it has been now, we can name many initiatives that were taken over the past few days, which is to go get the possibility of getting a teaching staff. You talked about the fact that there would be 2,000 who have skills in medical care. Now there's a decree for people who are finishing their studies. So it's been days and weeks that you are giving yourselves the means to go get the necessary reinforcements within our society. How is it that those people are not yet working in the network? Are we faced with a problem of reinforcements or rather a problem of bureaucracy? I think that the vast majority of people who are answering our needs are in the network now. We might have, dropped a few cases into the cracks, but those who really can help and who have the necessary qualifications are already in the network. I am very encouraged, of course, that there are 2,000 doctors who have accepted coming to really help out and lend a hand at CHSLDs, not necessarily to do, a doctor's work, but to really help out and lend a hand to the orderlies and nurses. And I think that in the next few weeks, we'll be able to take control back in CHSLDs. If we take the example of the teachers, there was the decree on Friday. CEGEPs are waiting for that list of the CUs to know what the needs are. People are ready. They're ready to be mobilized, but they're not getting a call to go places, or they don't yet have the list. Are we organized correctly for the information to be able to trickle down and that people be deployed? Yes, and we are doing it regionally. And I think that it is important to say that we have 3 different aspects for the education aspect, and we salute the people from the education domain who are coming to help us out. As you mentioned, we have people who are trained in health, and we're talking about people who are finishing their studies. That's the degree that we passed yesterday. So the nursing, the assistants, the technologists, medical, technological, respiratory therapist, all of these people, we didn't want them to, lose their year. They still have one term left. So we were able to negotiate, and in order for us to be able to benefit from these people who are going to be part of associations or professional orders, and that's a lot of people. And as you mentioned, we have professors and the support staff, and that is ongoing right now. And it's done regionally, the links with the teaching establishments. There are different initiatives that are taken, so that is really ongoing. And we are calling out to all students from any other programs, and there are emails that are going to be sent of any teaching establishments in all programs that could come and work with us as orderlies. So that is ongoing right now. It's a great collaborative effort with the education sector. And maybe just one point as well. As you know, I'm trying to be as transparent as possible. Of course, there are certain people who might fear coming to work in CHSLDs who don't know how to use the protective equipment, such as masks. So one of the big advantages of doctors is that they already know how to use that equipment. Somebody who has taught, who has studied, who hasn't used the protective equipment, I can understand that their representative wish to ask a lot of questions to make sure that we are not endangering their lives. So that is part of the discussions we've been having over the past few days. And I'd like to complete what the Premier is saying by adding that this is something that is planned. Training for those people who don't necessarily have training in health. For example, students of other programs and professors and the support staff. An accelerated training to really give them everything that they need for protective equipment and also for the organization of everything. So we're not sending people, without training those people. So we're going to be training them with videos that we prepared for that clientele. Mr. Legault, the Mayor Régis Labaume seems to be really uncomfortable with the idea of opening schools before the end of the school year. Are you still considering going back to school before the end of the school year? If so, how are we going to make sure that there's a physical distance between the students? That is part of the discussion that we're having, and as I said earlier on, we're not planning doing so in the short term. But we do not exclude reopening them before the end of the school year. So we are, of course, going to make sure that we take all the necessary measures in order to protect our youth. We're going to go first with reasons of health. And what I mean by that is there are all sorts of theories. Should we be immunized? The people who are less at risk to avoid too big of a wave in the fall. These are the discussions that we are having. But first and foremost, these discussions are about the health of the teachers and the children. Mr. Trudeau declares having had a request from Quebec yesterday for help from the army. I know that there were discussions about that. Why have waited until yesterday to have a request, and what exactly are you waiting for as far as help is concerned? What we were discussing with the federal government, and it wasn't clear at the same time yesterday, we thought that there were perhaps 1,000 people from the army that had medical training or training in health. Now, we don't have the number. We hear that it may be between 60 and 100. So for us, if there's 60, we're ready to take those people from the armed forces that have training. We don't want to send people with no medical training in CHSLDs. Two-thirds of Quebecers with cancer answered a survey from the Priority Cancer Coalition, and they say that the management of this crisis is hurting their care. When are you going to do more for people who have cancer, more treatments, more surgeries? We are very conscious of what it can create a crisis like this pandemic and people who have cancer, but I can tell you that I've been a lot in contact with the Deputy Minister and today as well with the National Director of Cancerology in Quebec. We have been following that file because we know how important cancer treatments are. So, as we've always said, everything that is urgent has been done, and we have opened where we could a little bit on, for example, semi-urgent surgeries for cancer. But as far as treatments, everything has gone on. Chemo, radiotherapy, all of that has continued. These are treatments that can continue. As far as surgeries are concerned, wherever we could, we gave alternative treatments in order to make it that we could conserve the state of health and protect the state of health of those people awaiting surgery. Today, there's been further discussions because, as you can see, the situation is still evolving, and we are going to completely open the MRI sector. So for all patients that have a cancer diagnosis and who need a CT scan or an MRI, it will be completely open as of now. So we evolve with the situation. We were doing it for the more urgent situations, but now we're going to be doing it with all patients. But I can tell you and assure you that if there's a file that is followed closely and very minutiously, it is that of cancerology. And I wish to tell patients that we are taking care of being in contact with everybody, the teams by teleconsultation, over the phone, and that we really wish to reassure them that we will be doing the utmost. A question for the Premier. A lot of Quebecers have the impression that nobody is accountable on what's going on in CHSLDs. Who is going to be accountable for this disaster that we've been able to see, this kind of carnage with the lack of staff? I think that the priority right now is not to find guilty parties. The priority is to take care of the elderly who are the most vulnerable, because that is what we're talking about in CHSLDs. We will then have to question ourselves. And I said it, we've known for many years that there is a lack of staff in CHSLDs. We know that there are many positions that are posted but not filled because it's not attractive financially. So we have to review and increase the wages of orderlies in CHSLDs. So the lists and the reforms that are proposed is something that we will do once the crisis is dealt with. For the time being, we have to deal with the crisis. We have to care for people in CHSLDs.
Oui, bonjour à vous trois. On sait que depuis le début de...
We know that since the beginning of the crisis, you have set up many recruitment plans. You have received 40,000 candidacies on the jecontribue.ca site, and our information indicate that only 3,000 of them were taken. Why? Are there so many people who did not present something interesting? Is there too much bureaucracy? Well, first of all, I want to give you a concrete example and you'll understand. First, we have to salute those people who have gone and registered on Je Contribue. It really came from their heart. But there has to be an equation as well. It has to be equivalent to the needs that we have in the network, and we really took all the steps very minutiously. And I'll give you an example. At the CIS of the Montérégie Est, we communicated with 1,668 people who went and gave their information to that CIS and who came from Je Contribue. We made interviews with 538 people, which brought to 256 confirmations who were hired, and 80 people decided to not go on, and so we hired the 160. This was a full process, and it was done everywhere in Quebec, particularly in those regions where we had a lot of needs, but that shows the fact that people want to contribute, but there are needs in the network, and there has to be an equivalency in terms of what we can offer and the needs that exist. And that entire process is something that we did. We contacted the people. It's possible that some people fell into the cracks, and I recognize that. But in fact, we did go through all 40, all the people who registered. And another example, there are people from certain regions, they want to work in the regions, but the needs are mainly in Montreal. That's an example. There are people who want to work during the day, but the needs in certain other places to work at night. So there's all of these examples. Beyond, do they have the qualifications? Do they have the necessary diploma, for example, to give the services that we expect having? So there's all that. But I repeat it, I do not see why we would purposely refuse a qualified nurse to come and work in Montreal. And that is why the site is still there, Je Contribue. And if there are people that we haven't yet called, I would invite them to go back to the site, and we'll get organized to contact them quickly, because we do want to tell people, go and register in Je Contribue, because we will continue to very carefully do the work to see whether we can have people who can come and contribute. You were talking about speed, Monsieur Legault. You talked to us about the emergency in CHSLDs. Since yesterday, there's 2,000 specialists, doctors, who raised their hand and offered themselves as reinforcements. How many are working today? Well, many, but some doctors have proposed themselves full-time, and others for 2 days, and others for the month of May or June. So we can't say that there's 2,000 who are ready to start working today full-time. But all those who are ready to work as of today, we are deploying them, and it's not going to be simple. As I was saying earlier on, taking a specialist doctor and have them work, they're not used to it. The nurses, the orderlies as well, all of these people are not used to working together. So it's going to be a lot of trial and error. But we owe it to our elderly, so we will integrate them within the network, and we'll do so quickly. And we need these 2,000 doctors. Hello, I would like to know, you made many calls for help. How many people since the 15th of March, let's say, how many new people have started working in CHSLDs in total? 2,000 doctors, but in total, how many? Well, we'll be making the evaluation very soon, because I can tell you that the list of the calls that we made, because we did a lot of things. You know, we have the students that I was talking to you about. We're going to be counting these as well. And there's also the ESAD, the social economy enterprises. We've fixed an agreement with them, and they will start now. They will start working in CHSLDs. And those are probably hundreds of people, because we have to see who will be arriving in the field. But that's very interesting, because these are people who are trained, who work in home care usually. So they are trained to be able to work with people who are losing their independence. We talked about the doctors. We talked about Je Contribue. We got 3,000 people through that. And we also have the caregivers. This week, we opened ourselves to them, and we're going to have people who are going to be helping us out in CHSLDs. So we will make a list of all that. But of course, with the 2,000 doctors, with the 3,000 Je Contribue, that's already 5,000 people. But we have to tell you that there are over 6,000 workers, or actually I think we're at 7,000 now, healthcare workers who are absent. They have to be replaced. And we have to replace them, and we have a gap. We have a shortage. We didn't have enough people to start off with. So of course we want to take all those people who want to contribute, because with COVID-19, we need more time to care for people. You have to put on the protective material, you have to remove it, you have to be more careful with the people who have COVID-19. So we need more staff to do that. On a more specific case, a resident from a private nursing home of 69 with problems of mental health who refuses to confine, who has no symptoms. So the police and the CIUS are saying we can't do anything, but at the same time he goes out and comes back in the residence, endangers the other residents in so doing. What are the recourses to prevent that person from putting all the other residents in danger? Well, there's an order that was done in terms of confinement of people in residences as such. The Director of Public Health will be evaluating the situation in order to see exactly what the story is, because we have to be careful of not going into people, who denounce people who are not at risk. But if there is a threat that is apprehended, the director could force them to be confined, even, in a coercive way. We do prefer to convince, but the means are there. The law on public health allows it for a period of 14 days, and it is reevaluated as such. So we really need an evaluation by the public health director who has that power. I'd like to come back to caregivers who will be able to help out in CHSLDs. You said Tuesday that it could start. According to the information that we have in the west of the island of Montreal, apparently that's been put on the ice because they weren't ready. They were taken by surprise. I would like to know how that's going on. Is that situation being repeated elsewhere? Are there many places where we're putting that on the ice because we're not ready to receive those caregivers? And did you go too quickly by announcing that? Should you have consulted the CUs before? Well, we'll inform ourselves, because I understand that we have to be careful. There are conditions that were evoked by public health that have to be respected. When we are in a CHSLD where there is an outbreak, the caregiver will not be able to go in. So we have to also see at the CUS what the situation is. We will contact them and give them all the support that they need, but that hasn't arrived to my ears, that there were other places where that initiative was halted. So we will call the West de l'Île CUS and inform ourselves. Still on the topic of CHSLDs, there was a call out to doctors, and what I am told is that in the field that had a demobilizing effect for two reasons. First, because we realized that with doctors we couldn't work by decree like with the rest of the healthcare staff or schooling staff, so where we have the impression that people can be easily redeployed without asking them what they think, whereas for doctors they almost have to be begged. And the other reason is because, in fact, there is an agreement for wages up to $2,500 for 1 day, so $211 an hour. And there are people who find that this makes no sense compared to what nurses and orderlies who are paid a great deal less. And considering that the federal help program is $2,000 per month, what should people understand? What message did you want to send to them? Well, first, what we want is for doctors to come and help, because we can't find enough nurses and orderlies. So we want them to come and help us to do nursing work. So that is not simple. The remuneration agreement that you're talking about was not for CHSLDs. It was for doctors who work in emergency in hospitals rather than operating on patients because of COVID-19. So it's not even clear if it's applicable or not to CHSLDs. I know that there's a lot of doctors who offered to come work in CHSLDs freely. So I think that right now, rather than having big debates on remuneration, we will fix it. But right now, I need those 2,000 pairs of hands who know how to put on protective equipment and who are going to help us take control of CHSLDs. And that is what is important, and that is what we're concentrating on.
La prochaine question nous provient par courriel de Marco Belair-Cirino du journal Le Devoir. Elle porte également sur votre site web Je Contribue, donc quelques...
About the website Je Contribue, 40,000 people have offered their help to nurses and orderlies in CHSLDs through this website. Why pressure specialist doctors to help out, especially in as far as their remuneration of $210 an hour does not seem to benefit of social acceptability, in as far as they might also put themselves at risk of contracting COVID-19. Well, first, the first thing that has to be said, and I was saying it first, I salute the effort of the people who want to contribute, but we really, especially in the hot zones, the regions where we have a lot of cases, we did all contacts with people who went on Je Contribue and registered. And as I was giving the example of a territory where, when we took all the steps and contacted almost 2,000 people, and I think we arrived at 200 people who were hired, we can see that there is an equation to be done according to the needs in the field. And so I thank those people who registered. But you know, for example, in CHSLDs, orderlies, nurses, and the equivalent is what we need. These are also schedules, you know, often at night, weekends, evenings. So there's that entire evaluation to be made with the people who wish to contribute. So we had 3,000 people out of the 40,000 who arrived with us in the field. The needs are very great. We have 7,000 workers who are absent right now. We were already in shortage, and we need more time to be able to treat people who have COVID-19 and reorganize all CHSLDs into hot and cold zones and having sufficient staff. So we need the doctors, and I think that they have answered the call. 2,000 of them coming as reinforcements, and we salute them as well. Still for you, Ms. McCann, the doctors who will go to the CHSLDs throughout Quebec, as your predecessor, Dr. Barrette, are they going to work under the order of nurses and orderlies who are already on the premises? What is going to be the command chain? How is that going to work in establishments? Well, I will tell you that first we have to have a spirit of collegiality. These are absolutely exceptional circumstances. It's not what is traditionally done, and we count on that. We have a very interdisciplinary spirit in Quebec, and the person who orders in the establishments, usually and doctors are used to that as well, is the manager. And it is that person, he or she, who organizes and coordinates. But it remains that our professionals, doctors, nurses, and orderlies, are people who are very autonomous, who are really, truly capable of, giving a hand and to organize services in interdisciplinarity together with the managers. So this is collegial management that we wish, especially in a context such as the pandemic. I can take perhaps 2 additional questions. Ms. McCann, I was told that certain hospitals have given directives to doctors who said that they would volunteer, that they won't be able to reintegrate their hospital before a week after the end of their work in order to avoid contamination. Are you aware of those guidelines, and what are the means to be taken in order to avoid those doctors who perhaps will have been exposed to COVID-19 of bringing that virus back to hospitals? I will say one thing on that, and I'll let Dr. Arruda answer you because that is a public health aspect. But I would like to say that with the 2,000 doctors raising their hand, we are truly going to make verifications to be sure that we do not assign hospital sectors that will, because they will be starting again gradually. But I think that those who raise their hands are probably those who can free themselves. So I trust that. As far as the 7-day measure, I'm going to go to Dr. Arruda since it is a public health aspect. Well, it is clear that it is an issue of transmission when one is symptom-free. The doctors who will have practice in CHSLDs or in certain centers will have used precautionary measures, so they will have protected themselves. And independently of the department in which they will have been sent to, there are perhaps departments that will have more severe guidelines because of the potential of, people who are immunodepressed. But I think that this is an orientation that could vary according to the establishment and the particular situation of each individual. So it's not necessarily going to be applied everywhere in the same way. I think it's also to take into idea, will the doctor have worked in a center where there was an outbreak? These are all things that have to be taken into account. quickly, when is the serological screening? Because we're talking about a deconfinement plan now. There are people who are saying that there isn't enough collective immunity, but to get that, we do have to deconfine. So we're kind of like in a catch-22 situation. When are we going to be able to measure who has immunity, or to have a better idea? Quebec is part of a Canadian consensus of seroepidemiological studies, and it's interesting to see what's going on here and to compare it elsewhere. The discussions are ongoing. The specific data, I have to say that I don't have it right now, but it will be done in the course of the next few days or weeks, but not much delayed. There are certain issues aligned with reagents and the test itself that can be used, but it's coming pretty quickly, and Quebec is going to be participating. If it starts in Canada, we're also going to be part of those studies. Before going to English, a question to the Minister for Health, Ms. McCann. A report published on Thursday reveals that over the 2/3 of patients in oncology have had their appointment postponed or delayed and or cancelled, and they feel abandoned by the system. They asked for a launch plan to be organized for the after-COVID period. What is planned about this? As I was saying previously, this is an aspect, all the cancerology aspect that is followed systematically. I spoke with the National Director of Cancerology, Dr. Latret, today, and I regularly talk to the Deputy Minister who also cares for this file. But what I can say is, yes, there were things that were delayed, but from a clinical point of view that did not have an impact on the state of health of the patient. And on that, there are surveillance committees, there are follow-up, cancerological follow-up committees who evaluate all the situations together with clinicians. So, for example, we treated people without putting them at risk to avoid, taking a week more, to avoid there being contacts with other people who might have COVID-19. So we truly were very careful. And now the situation is evolving. We gave alternative treatments before surgery because we have delays as far as cancerology is concerned. But of course, in the present context, we could not do everything in the same way. Everything that was urgent was done. We are, in fact, now doing semi-urgent work, but in fact, we did take a lot of precautions. But at this time, on top of chemotherapy and radiotherapy that always continued, we are going to open more and further the sector of medical imaging for all patients who have cancer. So that is going to help out those patients, going to do a lot of good. And I have to tell you that doctors and clinicians, through teleconsultations and over the phone, have been in constant contact with them. English questions now.
Good afternoon to all of you. Dr. Haruda, I'm sorry for your loss of this young colleague of yours in health, community health. You said it. The news is out, and with this news comes lots of fears. What do you say to Quebecers and healthcare workers?
Okay, first of all, I want to say that when I talk about numbers of people dying, I know the drama that is going in each family for each colleagues and loved ones, first of all. And I think this case is like, I would say, the impact in families that is the same as others, even if they are older or that. First of all, for the reasons of confidentiality, I don't use to comment about one specific case. But what I want to say, because it's already in the media, and because people are going to healthcare, people are going to shared facilities, they will think that the healthcare worker is at a higher risk when he's giving caring. It's clear, but they protect themselves too with different things. This health worker didn't work in, I would say, hospital or long-term care facilities. You get the disease somewhere else. So it's one I want to say that we must remember that those regions are at risk for people who are very sick and are, but you can get the disease elsewhere. So be careful and just listen to the recommendations we give. So because the virus is transmitting inside of healthcare settings, especially long-term care facilities. And we see the big impact on elderlies. But at the same time, you can get it at work if you don't respect distanciation and if the people are symptomatic. So it's why we are telling people, please listen to this thing. And if we do reopen things, we do that in the way to protect everybody.
Okay, second question. With canceling of non-urgent surgeries and clinic visits, you've been saying that hundreds of beds are available for COVID patients. There is a VP with the FIC. Her name is Denise Joseph. She says that that means that nurses are being sent home because there is no work. So why in the strategy these nurses that were available have not been called first instead of sending messages that we need people, that we need orderlies, that we need specialists, that we need general practitioners? Why we've not focused on nurses that were available according to the FIC?
Well, the information I have is that we have called on nurses who are in the hospital sector to come and help in the long-term facilities, and I have concrete examples where it's been done. So we've done everything we can to get those nurses to come and help in the long-term facilities, and they have done that. So the outpatient clinic, we want to reopen them gradually. And also some of the nurses may be in first line, but some of the nurses in first line, they are in the clinique d'évaluation also. But yesterday I've asked the sous-ministre to call upon the PDG and ask if there are some more nurses that could be available in the outpatient clinics. Of course, it's a balance. Because the outpatient clinics will probably reopen gradually. But we're doing everything to get as many nurses as we can in the long-term facilities.
Next question, Samuel Pouliot, CTV News.
Hi. There are many former nurses and others with healthcare experience who have volunteered to help in the pandemic, but they didn't get any answer. Why is that? And why did Quebec ask doctors to help when so many were available and volunteered, especially now that unions are criticizing the plan because it's unfair to pay. It's an unfair pay for those who do the job.
Well, the first thing I think to say is that what the physicians will be paid is inside their envelope. It's not an additional budget. It's already in their envelope. So we're not, putting out more money. That's the first thing I want to say. The other thing is that we need thousands and thousands of people, not just a few hundreds, thousands and thousands. So, of course, maybe some of the nurses, they fell between the cracks, but I invite them if, they want to be on Je Contribue, if they are outside of the network, for instance, we will, of course, follow up on their offer. But we did contact everybody we could, and there are a few probably that we missed, but we want them. So if they want to contact us through Je Contribue, we will contact them for sure.
Okay, and how can caregivers prove that they don't have COVID-19 to be able to enter seniors' homes to safely take care of an elderly or when testing, facilities will not test them unless they're not showing any symptoms.
Maybe I'll ask Dr. Arruda on this.
You must understand that they will work with masks, and so if they were asymptomatic and trying to spread, they will. If they get a story of exposition, they're going to be tested. But if they are getting and they have no symptoms, they will wear masks, and so they will not contaminate. And they will use, I would say, the hygiene issues. It's not only wearing masks, I always remind you, it's a way to put the mask, it's a way to take it out, it's a way of taking out your gloves and wash your hands.
Thank you. So now the next question are from Raquel Fletcher, Global News. The first one is for Mr. Legault. Alberta and BC have stopped staff at senior residents from moving between facilities weeks ago. Ontario stopped it as of yesterday. Why is it still happening here?
First, we've asked all the people that were able to stop it since weeks. Of course, when we're short of staff, sometimes it's impossible, but every time it's possible not to have somebody going at more than one place, we're already doing it.
Thank you. The next question is for Dr. Arruda. We're hearing about many people staying positive for a long time after symptoms disappear. Why is that? Is enough being done to test healthcare workers?
First of all, it's clear that we can detect some virus with tests even for a long time, but it doesn't mean that the dose, because for getting infectious, you must have a certain dose of infection. Most of the transmission seems to be done just before getting the disease, I would say less than 1 day before. It's what this new study is telling. And I would say during the symptomatic phase, and most of the time those persons are at least 7 days without having any symptoms before they can get it. So with this, I think we can lower the risk. And don't forget that the test is sometimes good, but it could be false negative, false positive, and when it's not during the catching up period of high circulation, it's more difficult to interpret the test.
Thank you. Now question from Phil Autier, Montreal Gazette, for Minister McCann and Dr. Arruda. We are again getting questions about testing. You have the capacity to test 6,000 people a day. How long will it take to test all the healthcare workers and residents in CHSLDs? It was promised a week ago, but does not seem to be happening. Can you explain why?
Well, we're giving priority to the CHSLD where there are éclosions, and to CHSLD where there are a certain number of cases. So that's being done now, and gradually, I hope we'll get to all the CHSLD, but we have to give priority to those who have cases of COVID-19.
And a very last question for Mr. Legault and Dr. Arruda. Theories are emerging about why Quebec and Montreal in particular have become the epicenter of COVID-19 in Canada. Why do you think this is the case? What are the factors to explain this?
Well, I think, first of all, based on the data, there could be, I would say, some higher declaration in Quebec because we have a bigger, I would say, test capacity. But I would say there is probably not only one factor. There is going to be a combination of factors. It could be in relation with, I remember it again, the school break that arrives before, I would say, frontiers were closed. It's also the kind of travels that Quebecers are used to be. As I told in BC, it's almost China who contaminate, I would say, Vancouver, and then China stops the airplanes, so the transition was not there. We used to go to France, to Italy, which are, and Europe a lot, so this probably during the school break was infected a lot of persons, and even after coming back, before the frontiers have been closed. And also there is this New York situation where we have some communities and would see a lot of people from Quebec going to New York. So it's all probably that mix up that make things. One thing is sure is that we had make very early decisions to stop the spread. I think even if we are observing a lot of cases, it would have been worse and very worse, and probably our healthcare system would have been, I would say, in big tension if we had not taken those decisions. And now, I would say probably we'll see with seroprevalence studies what was the rates of seroprevalence here in Quebec compared to others. And it's only in months from now that we're going to be perhaps answering the reasons why Quebec is more attacked. But it's probably all that kind of combination, because we do practice. I want you to remember that Quebecers were the ones who are respecting the distanciation, physical distanciation. So, in fact, it's probably unrelated to the rate of, I would say, virus getting in a place. You cannot do the disease if the virus is not there. You can do the disease if it's coming.
Thank you. Donc, c'est ce qui complète pour ce point de presse.
This puts an end to the press conference. Thank you very much, and see you all tomorrow.